So hey, this is Gary. I'm with the Ben and Gary Show. Ben is not here today. He's sunning himself on some beautiful beach somewhere down in the southern hemisphere or somewhere. I went to a course on airway prosthetics about 2 weeks ago, and it was given by a doctor named Jeff Rouse, and this guy was fantastic. He gave a lot of very good information, and it's really about airway patency. So that's what I'm going to talk about. And we've talked about obstructive sleep apnea before, and so that's where you have different types of airway obstructions, and that's typically when you are referred to a medical doctor to have a sleep study done. Now, what I've learned from the lecture is that there are parameters that are given so that they can diagnose you with sleep apnea. And so that comes down to how many times you wake up during the night, or whether you rather stop breathing, but then you have to then catch your breath. And for mild sleep apnea patients, these events can be from 5 to 15, and then for moderates, 15 to 20, and then above, or actually to 30, and then above 30 is you have severe sleep apnea. So what happens is that when you are aroused, it interrupts your sleep, and you never attain the good sleep that we like to refer to as REM. And that's where you have a deep sleep, and that's when your body can repair itself. So it repairs itself by releasing hormones, and your brain has a chance to relax and rest and repair itself also. And so when you don't have that, that's when you wake up. You don't feel very rested. You can be a little bit cranky. I don't know if you know anyone like that, but you've probably run into some people that you work with that maybe just a little bit cranky in the morning, so you try to stay on their good side. But anyway, all these can lead to various techniques that you develop to try to help you breathe, and that can be things like grinding or ruxin at night. It can lead to TMD problems, and we're finding out there are other health-related issues with these interrupted sleeps. So what Dr. Rouse talked about was the fact that the parameters that are given to define sleep apnea can actually or shut out some of the people that actually have sleep problems but aren't diagnosed as having sleep apnea. So there are milder occurrences that happen during the night, and that can be more leaning towards airway resistance. So you may not have an hypoctic event, but it can be still lead to arousal. So what he talked about was what we call an upper airway resistance syndrome, and that's where you have more resistance continuously through the night, but it leads to these arousals at night. So, and that can also lead to not having a good rest as far as sleep. So what he has explained was that can lead to depression, anxiety, and pain. So when you have these repeated events, that's when you're going to really feel like you're not rested. So when you don't have the REM, REM usually occurs more towards the end of your sleep cycle, but earlier in the sleep cycle you have times when you get to a deeper sleep, but then you'll have times where you have dreams, and it's a cyclical event. So you get back to a deeper sleep, and then dreams, and then down to REM, and then you wake up. But what happens with these, when you have airway resistance, you have probably more body motion or restlessness, And when you do wake up, not wake up, but to have these arousals, then your brain doesn't get the rest that it needs. And there are different ways that he explained that this can be measured. So he has a device called a cardiopulmonary coupling, and so that measures heart rate variability with respiration. So when you look at the data that comes out from these studies, with it's called the CPC for short, but you can see there's peaks and there's valleys, and that's the ideal. But when you have a person that has arousals, you don't have those peaks and valleys. It's pretty uneventful there, and that just means that your patient's not getting very good sleep. So the bottom line is that we need to make sure that you're sleeping well, and that sleep is basically occurring if you have good airway flow. So one of the things that he talked about was making sure that your patients, or our patients, have good nasal passage airways. And there are various things that can occur, such as a deviated septum, that can prevent people from having good nasal airflow. And so that's where ENT would come in and help to correct that. But the bottom line was, as far as how do we correct this, is to, of course, with obstructive sleep apnea, you have mandibular advancement devices. So with that in place, you would also, he recommended putting tape over your mouth, so that it forces you to breathe through your nose. And that's where the nasal airway patency comes in. So if you get this good sleep, then you're going to wake up much more refreshed. But along with having the mandibular advancement and the tape over your mouth, there are other types of treatments that can be done to, go into further treatment as far as more complex treatment, or possibly, or more prolonged treatment. But the bottom line was to get good nasal airway breathing, so that you get a good night's sleep. So that's it in a nutshell. There's a lot more that we could talk about, but I'm trying to keep it on the shorter side. So we'll talk to you soon. That's the Ben and Gary Show, and hope you do well. Take care. Bye-bye.